Hey, brother.
What's up, Charles?
Nothing much. How you doing, man?
I'm doing good, bro.
Good, good, good.
My video is a little, my camera, I don't know what's going on tonight. It's a little, when I go in certain angle, it skips like, whoop, whatever. I'm not going to move. I'm going to stay still. Aloha Monday, everybody. Welcome tonight. Oh, gosh. Tonight's a big night. Going to be fun. Going to be interesting. Going to be exciting. More importantly, it's going to be informative, guys. It's going to be informative. I expect a lot of people on tonight. Especially the people out there on Maui, our brothers and sisters out in Maui. Tonight we have Dr. Pang, Lorrin Pang, Dr. Amy Ho, and Dana Moore, who's going to share with us their report. I don't know if you guys had a chance to see this report, this study that they did. It's a pretty lengthy study, and I'm not going to steal their thunder, but check it out. It's pretty pretty good report. Actually, it's a very good report, and I'll let them explain what drove them to doing the study and the results of the study and what recommendations they have. Now, uh, this is factual data. This is based on the testing that was done on Maui. So I'm excited, man, Charlie. I'm excited to hear from another island and see how they're doing. And we know Maui is has their own challenges right now. And
Yes,
absolutely, absolutely. Even Oahu's numbers are climbing again. So please share this, guys. I think this information is vital. Um, you
mm,
know, because again, and I think we've said it enough times, we are no different than any place else. We're just as vulnerable a population as everywhere else. So when we see what's going on in Florida and some of the other states where they have completely disregarded the mask rule, or they removed the mask law, the mandatory mask mandates. You see the spring break parties happening in Florida. I watched it on the news tonight. Now, how many of those people are going to eventually make their way to Hawaii? We don't know. And we're on the verge here on Kauai. We're on the verge a week or so, a couple weeks away from rejoining safe travels for Trans-Pacific. So, we got to be careful. But I tell you, I think the information, if you didn't see this study yet, I think the information that you'll hear tonight is going to make you think um, about the vulnerability of our islands, regardless of which one you're on.
mhm.
So I'm excited, Charlie. I really am. I tell you, I was excited all week. I could not wait for tonight.
Well, for me, and I apologize, I'm trying to get my things set up. For me, today was just one of those days that I taught several classes yesterday, and today was one of those days that I just had a really tough time getting into gear, man. Whew. I don't know what it was, and I was a little frustrated, I guess. I got this video of a person returning from the protest on Oahu. Person lives here on Kauai, and she documented her willingness not to comply, and she talked about it all the way from off the plane into the safety area, and she just started right off the bat telling about how she's suing the state and all that, and it's the officer did the right thing. He explained that we're not here to try your case, but we're here just to enforce the mandate ordered by both the governor and the mayor of Kauai. You know, and still it never mattered to her. So it's stuff like that that really it really empowers those who are defiant to say, hey, if she can do it, we can do it too. The next thing you know, we get chaos, and we got to try to. I mean, yeah, I want to, like we said, we all want to walk around with no mask, but that doesn't seem like it's going to be a reality anytime soon. And then you see that that hearing both Rand Paul had with Dr. Fauci, and it was pretty intense. It was pretty intense because they tried to discredit Fauci about the mask wearing, saying that it's just a for show. And he basically said, the vaccines does cover. It was designed to cover COVID, but now with the variants, the mask is that additional layer of protection because we still don't know about the vaccine with the variants. We're not positively 100% sure if it can or cannot, stop it in its tracks. So why not err on the side of caution, right? But again, people just want to create an argument, so it creates confusion. And with confusion come many deaths. And the shoulda, coulda, woulda can be too late when somebody's lying on a hospital gurney, taking their last breaths. So all we're trying to do is promote safety. If our own state is not gonna take care of its people, then at least we got to arm up people with safety factors to consider. That's all it is.
Just want to say a special mahalo to all of you on the mainland, on the East Coast. It's 1 a.m. for you. Thank you guys for being here. Charlie, I echo your sentiments, man. I get frustrated every day. I saw someone post in that anti-mask protest. Someone said that the mask mandate is not a law. Well, the mask mandate is not a law. The law is violation of the governor's order. That's the law. The law is not the mask mandate. They didn't pass a law prohibiting masks or requiring masks. The governor in his emergency declaration put the mandate in the emergency declaration. Violation of the declaration is the misdemeanor, not the mask. So these guys are out there talking nonsense. People listen to this crap and then they do things. And you're right, Charlie. And that's again, it just comes back to for us. Okay, here we go. We have our guests in. Let me see. I'm going to bring in Dr.
I don't know.
Go ahead, Charlie.
I see they got this Padma. I apologize.
Yeah.
I'm not sure how the person got the invite.
Yeah, I'm not sure who that is. So unfortunately, they're going to have to wait in the waiting room. Aloha, everybody.
Aloha.
I see Dr. Pang. Dr. Pang, I don't know if you notice, he's always, the camera only goes up to his nose. You notice?
What's that?
I noticed that when we were on the oops, oh boy, on the last, but I thought that was just something that you enjoy doing. Like the guy on that show before, the comedy, what is that sitcom that the guy with the neighbor's fence, he would only come in, you would never see his face.
Yeah.
Anyway, I want to welcome all of you. And I'll let you all introduce yourselves just because it's easier that way for me. But first of all, the Hawaiian up there is Charlie, Iona, Uncle Charlie.
Hello, aloha no, everybody.
We are honored and privileged to have Dr. Lorrin Pang, Maui Health Officer, District Health Officer for Maui, Dr. Amy Ho, also with the Department of Health from Maui, and Dana Moore, who is kind of like the person that put us all together. So thank you all for joining us tonight. We're gonna have a big audience tonight. I know it's been shared a lot of times, and a lot of tonight we'll be talking about this report that you all did, the study, but not sure where to start. But Dr. Pang, I think we'll start with you. You look angry, so if you can smile a little bit. You're exhausted. I know you're exhausted, and thank you for your work that all of you are doing. But let's start with you, Dr. Pang, maybe brief introduction, and then we'll go on to Dr. Ho and Dana.
Okay, I take it you want an introduction about the study, right? Not about me.
How about you? How about you? We'll get to the study. Yeah, just briefly. I read your resume. It would take an hour and a half just to get through the resume. So
okay, briefly, I'm from Hawaii. My mother's from Paia on Maui. In fact, her mother was from Paia on Maui. Then I went away to college to Princeton. I majored in chemistry. And then I went to medical school down in Tulane University. Right after that, I exchanged student. I went to northeastern Brazil for a year. And then since then, I've lived in Brazil 3 times. I lived in Southeast Asia twice. I was with Walter Reed Army Institute of Research, doing field trials of drugs, diagnostics, and vaccines. And I worked for the World Health Organization advisor for 20 years, same project, working in Africa and all over, mostly chasing malaria. But a lot of our work was whatever disease they had, rabies, hepatitis, HIV in Brazil. And so then I retired because my folks were old. So in the year 2000, I came back to Maui as a health officer. I could sign anywhere. I thought the job was on Big Island, and they said, no, it's on Maui. So I signed to Maui. And since then, I've been on Maui. The last maybe 7 or 8 years, I as an advisor to the US Congress for Medical Research. We fund about several $100 million a year. It's quite anonymous, so I cannot tell you what committees I sit on because it might be collusion, but I can say that, they said to say that I'm part of these committees now that look at these things. And we've been watching, even before COVID, we watched into Zika and Ebola. And once again, funding drugs, diagnostics, and vaccines. So we'll leave it at that. I don't know, I got a bunch of publications, about 6 dozen. And then that's it. I'm set for retirement, but then COVID hit and I thought, well, this is what we live for and practice for. So I stayed on. Okay, thank you.
Well, thank you. Quite impressive, my man. All right, Dr. Amy Ho. I hope I said that right.
Yes, you did. Thank you so much. Yes, it's Dr. Ho. Pretend like there's no you. It's easier to remember.
Okay.
Or like Santa, ho, ho, ho. That's how my patients sometimes remember it the best. Hi, everyone. I'm Dr. Amy, or Amy. And both my parents are originally from Hong Kong, but I was born in the States and then grew up near Boston in Massachusetts. I studied electrical engineering at MIT and also did a master's there. I did some healthcare consulting, and then finally I just felt very much in love with medicine and wanting to serve and help others. And so I went and did medical school at Boston University and residency in Boston. And then I'm certified in internal medicine. And then my sister told me a little while back about some telemedicine. And so I actually looked into it and I've been doing a lot of urgent care and some primary care through telemedicine. So that's kind of like the medical stuff. And then in terms of, I have a heart also for global health, like Dr. Pang. So I've spent some time in Rwanda working for NGO. So we were doing medical, like electronic medical records there. And then I've done a lot of ultrasound, and I worked in Peru doing parasite work. I've also volunteered in India, New Zealand, and Taiwan. It was my husband, actually, we moved to Maui February of 2020. So actually last year, it was a family decision and we had decided it even before COVID. We have 2 young kids, one and 5. And so since then, coming on with, COVID coming to the world. And then my husband happened to find an article about Maui District and the work that they were doing. And so that's how I cold called Dr. Pang. And then we started, we connected, and then I started helping him with figuring out COVID and the travelers, and then been helping him with the rollout for the vaccine and the whole public health department. It's been really exciting, and we're just really glad to be here. Thank you so much, Mel and Charlie.
Awesome. Parasite work. That's on my bucket list. That's actually on my bucket list. Dana Moore, world famous Dana Moore, master organizer.
Oh my.
What's happening, Dana?
Parasite worker, didn't you? Isn't that something you used to do? I don't know. Thank you for having us. Yeah, I'm just grateful to be here. And, my daughter said to just pretend like it's any other meeting, like the millions of other Zoom meetings that we're on. So I just wanted to thank you and thank Dr. Ho and Dr. Pang for allowing me to be a part of this. And yeah, I'm from Maui, born and raised. I didn't know that Dr. Pang had Paia ties, because that's where I grew up for most of my time in Skill Village, which is like a little plantation village, right across the street from cane burning and all of that good stuff. We don't have sugar cane anymore, but I've been here my whole life, and hearing that they have done so much travel, it's amazing to me because I was the one that never made it out when I was 18. And once you miss that point, it's like you never get to leave. So I've been here and, just been super duper grateful to be involved in all of these volunteer efforts this entire year. I am a volunteer with the Medical Reserve Corps as a nurse. I started getting involved it's been a year now. Tomorrow will be my year. I was on the first test sites with Dr. Scott Miskovich. They trained us over there to do, I was in the swab tents and, just boots on the ground kind of thing. Also involved with Hawaii COVID-19 Healthcare Provider Task Force. The website is highcovid.org. And we really have a lot of amazing community group efforts that are going on. It's a statewide effort. Mel and Charlie, you know everybody that's involved, all of these amazing experts that you've had on your show, and many more actually, and a lot of community people who are leaders in the community. We have collaborations with educators and just some really brilliant, amazing volunteers. It's all volunteers. So I just wanted to give a shout out to them because we're turning a year old and still going.
All right. Well, thank you. Thank you for all the work that you do in the community, all three of you. Let's get to it. Before we share, if you haven't already, go ahead and share. I keep getting people trying to get into the room. I'm not sure who else got the link, but this is the share time, guys. Everybody hit the share button now. And let's get this out. Dr. Pang, this is what we'll discuss tonight, but maybe give us a real quick overview of Maui and what triggered this. And then you all can take over and talk about the study and what you all found. How's that?
Okay. The issue on Maui, specifically for that, we knew that Maui was getting a lot of visitors from the mainland or travelers, right? Either returning residents or out-of-state residents. And we were wondering, this is November, right? How much COVID was coming in? So we knew that the state had done safe travels, and everybody knew that even with safe travels, there's some cases that will come in, because when you do one test before coming in, well, you could miss a bunch of people. They're incubating, so the initial test was negative, but they were already inoculated and growing it, and they'd show up with it on Maui. Or after the test, if you got it 3 days before coming, goodness, you got inoculated the day of the test or any time after, or at the airport traveling in. So we simply wanted to see how many people really are carrying COVID in those who come from the mainland. So meantime, there was another study going on by Dr. Miller, and they were asking people, travelers, will you please get tested when you come? And that's voluntary. That's voluntary. So they asked 10% of the people to get tested. And out of that 10%, just about or a little bit under 10% said they would get tested. So it's 10% of the 10%. But the participation rate was so low that we didn't know if that would be a true reflection of the people coming in. In general, when you have people self-select and it's very low participation, you wonder if there's really a bunch of positives out there who don't want to get tested, because if you get diagnosed here, that ruins your vacation. You're isolated 10 days. All your guys, you coming in with quarantine for 14 days, and that messes up your vacation. So it's understood you don't want to get tested. And when you do that, it's self-selected. You don't have a good handle on what you saw. No matter what percent you see, it could be underreported. And in some cases, it could be very overreported. Well, why is that? Nobody wants to be tested, but man, I'm going to get tested if I'm real sick. And so out of the people you test, oh man, you're real sick and it's real positive. So we said, okay, enough. Let's try do our own study. And we thought we could ask people to get tested, and they know the result. They keep a little diary We test them every 3 or 4 days. And lo and behold, when they leave, they give us the diary. We don't do anything because they're already left. And we said, oh, look, you really were or were not positive. We knew they were going to be positive because in the meantime, Oahu had been sending us construction workers. And part of the deal was you only go to work your construction job and you stay in the hotel and we test you every 4 days, 4, 8, 12. And turns out that a lot of them who tested negative when they came in, they call me up and say, hey, it's working. And I said, what does that mean? Oh, I was, negative, negative, positive, negative, 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 positive, negative, positive. So we knew they were incubating. So we just asked maybe the visitors could do that. They said that was unethical. Some of my own team said that's unethical. You're holding a result and you're not acting on it. You're not telling all the people in the hotel the guy's positive, so stay away from him and isolate him. So I said, okay, can't do that. So we did the departure study. When leaving, you're already going to leave. I'm not going to mess up your plan. Can we test you? Because you probably came in positive and probably still positive if it's less than 14 days. We will get the result. We'll do a good test. We will know the result. If you want, we can try to contact the hotel and all your activities to warn them there was a positive, but it's anonymous. I can't say it was you, but I would tell the hotel there was a positive going through. So we did some, little bit focus groups before we started this. And most of the visitors said, yes, if you do a good test, if they got the result, the home state never got the result. Honolulu could get Hawaii, Maui could get the result, but we couldn't say who. Then they said they would volunteer. And now we said, okay, fair enough. We're going to choose you randomly to get a very good sample, one per family. We choose. And then hopefully you get a good participation rate. So that was quite interesting. We knew the kind of person coming in, and we'd kind of leave it just at that. I think that's what you want to know about the study design. There's 2 cautionary notes I want to say. When you test people like Maui, they were not having an arrival test. Having an arrival test qualitatively changed the kind of visitor you get. Yeah? Well, what do you mean qualitatively? If there is no second test on arrival and a guy passes his pre-travel test and he's negative and he's exposed and he's sick before he comes, who cares? He's going to come. He's got that negative test. But if somebody's stuck on an arrival test and says, yeah, you pass that thing, but you watch out because if you're exposed and you're sick before you come, I'm going to pick you up at the airport and I'm going to ruin your travel plans. There's no getting out of it if you're positive and all your family exposed. So qualitatively, it's a different kind of patient. Next, in general, you want to sample something. What do you want to sample? How many guys going to vote for politician X? You want it representative. You don't say, hey, all you guys, I'm going to ask you, but not you. Okay, so it's generally a representative sample is a random sample. Good. But anytime you self-select, it automatically distorts it. Okay, so if I randomly chose, but let them self-select or self-deselect, like I don't going to be in your study. Yeah, I chose him randomly, but he's not going to be in the study. That messes it up. Or if you self-select and randomly choose among those guys, it's messed up. Anytime there's self-selection, it's kind of messed up, okay? So we randomly chose, and then they did self-select. But we had a very good participation rate. Generally, 70% of a randomly selected study is pretty good. And then you always check. The 30% who didn't participate, Dr. Pang, man, that could really be those positive guys. Actually, no. In the publication, it said those 30%, did you self-select because you were scared to be positive, detected positive, ruin your travel vacation? No. They said, oh, you know what, I kind of got to catch the plane. Or they said, I don't want that invasive thing in my nose. So they're self-selecting, but not on the factor you're looking for, COVID. I'll leave it at that. Amy and Dana, you can carry on, and then we'll field questions.
Thank you very much. Dr. Amy?
Sure. Thank you, Dr. Pang. So he gave the background of what motivated us to do this and then kind of the process of narrowing down our design. And so what we did was we went to Kahului, the main airport. We were around 5 different departure gates, flying back to mostly California, Washington, and also one inter-island to Big Island. And there were a few others, but those are the main ones. We did this study during November 20th to 30th, so kind of around Thanksgiving. And we felt very confident that our test, we were testing, random, we were approaching people. We were asking them to voluntarily do this to help us with our kind of our travel program. And, more than 72% agreed to do it. So we were very happy with that participation rate. We gave them, a free Hawaii mask as a thank you. So we solicited over 570 people, but a lot of them were ineligible because we were looking people that lived in the mainland, were in Maui for 14 days or less, and had a negative COVID test beforehand, because some folks came in and just quarantined. So we were really looking for a very select group, and we found that they were very representative of the general tourists that come. They stayed at the popular places in Maui. They did excursions. They did different activities, and as a whole, we felt they represented very well the general tourists that come to Hawaii. And so 282 of those were eligible and agreed. And then 180 or so declined because they're either uncomfortable or they just didn't want to do it. So we had 72% participation. And so of those we tested, one sample got leaked, but 2 out of those 282 were positive for COVID, which projects out to, if there were 1,000 travelers coming in, that would project to 7 being positive. To elucidate more about the 2 that were positive, one was from California, had no symptoms, got tested 3 days before travel, stayed on the island about 7 days, and then flew off. And then with the second traveler is from Wisconsin, also was tested 3 days before traveling, had no symptoms, was in California for 1 day, and then stayed at a lodging in Maui for 1 day, and then traveled beyond, and we believe probably to the Big Island. So those are our 2 positive cases. And when we did these tests, we did do the more accurate, the PCR, so we weren't doing the rapid test. With that projection of seven per 1,000 travelers, that's definitely concerning. Since we're having easily, especially during that time, Hawaii State was having at least 10,000 travelers to the state daily. In that like on a week period or in different periods. And so when we calculated that out, that works out to be about, like in November and December, it was probably about 50 to 70 potential travelers coming in that were infected per day. And for Maui specifically, 17 to 30 potentially per day. And that's, really disturbing. And so right now, that's more than we're hoping to handle, especially with the variants being potentially more infectious. We're really trying to have a discussion about post-arrival testing, using a rapid test, for example, so then we can test them, get the result in the airport, and then decide, and then we can direct them right away if they're positive. Also, whether or not to quarantine again, coming back. So those are some things that we're thinking about. And then also we did a test like this again, whether or not we could test for the variants as well. So not just tracking COVID coming in, but the variants coming in. And especially with Kauai opening up soon in April, I think we all are on the same page of just wanting to keep our island safe, since, especially for Maui, we only have 1 hospital and ICU. And so I think we're very aware of our limitations and resources. And so we're all working together, but we're so glad to be here. We're glad to at least have done this report. And again, we were able to get this data in about 10 days. So I feel like it's very replicatable, like on Kauai, back on Maui, on Honolulu. And then, over the weekend, there's more travelers coming now to Maui than even Honolulu, like over 5, they're both reaching 5,500 or more per day. So that's a lot of travelers, and especially with Maui getting so many. So it's concerning. But that's from my end. And Dana, would you like to?
I know a lot of the people that had planned to come to Kauai changed their flight plans to Maui once they knew they had to quarantine or go to a bubble. So we're a little responsible for that, but I support that decision. The other thing I wanted to say real quick, just to validate, that Kauai discussion group came up with a study with Dr. Evelyn, Dr. DeWorkin, and many others, and they came up with that prediction or estimation of 7 per 1,000. That was the exact number they came up with, and in fact, at the minimum, could even be higher, based on the studies that they had done. So it's consistent with your study, which pretty much validates the study as you conducted it. I really am impressed with the 70+% rate of people taking the test. That's incredible. So awesome job. Dana?
Well, really, I'm just considering myself to be the backup singer here. And just, they covered it really well. And, I think what I can say from just being involved in the process, from the setup and the planning meetings to the execution with the volunteers and recruiting, it was really interesting, I have to say. It was very challenging, but then in a good way, because you don't want to get that no, and that they're declining, but you just have to be really careful with how you're going to recruit people and be really careful so that you don't invalidate the study. And so we just did it all with volunteers, including Dr. Pang and his daughter, who's also one of the authors on the study, and Dr. Ho, and some of the just awesome volunteers, some associated with the task force, and everybody just showed up, and some days were busier than others, but we had to approach these people who were just ready, to get ready to leave. And then it's like, hey, do you want to have a really uncomfortable test, and I wanted to do 2 nostrils, when I was swabbing them. Dr. Pang was like, maybe just 1 is good, because, we don't, but I'm like, hey, they're going, they don't care. But yeah, so, we made a compromise with the 1, and I'm just being, it's a little inside joke now, but yeah, I think everybody did such a really good job, and people were inclined to help, which was really interesting. And I found that in interviewing, these people who were returning either home or to another city, they were honest with where they had been. They were open to answering the extra questions, which were not mandatory, and they were concerned about the safety of Hawaii. And so that was really relieving. And I really had not had the opportunity all year to interact with these visitors who, I don't want to say anything not PC or whatever, but, as a resident who's used to being on an island with extremely limited resources, very limited hospital capacity, it's been concerning all year with the anticipation of opening. So it was relieving that, I was able to actually speak with some of these visitors, and, we're not saying go home visitors, but we want to do this in a safe way, because we need to support the economy, but we also need to balance that with the safety. And I feel that this study was a really excellent opportunity, to demonstrate the numbers that were being estimated by the experts, who have really been valuable, and their voices are valuable. So kind of amazing that the numbers came out the same coincidentally. But the other thing was, I have to give a shout out to Dr. Ho and Dr. Pang, because they're at the same time that this study was rolling out, the vaccination the vaccination drives were rolling out. So a huge disaster response effort was happening concurrently. And so we're doing all of, and they're leads in those efforts, so it's very an extreme amount of work, and I'm really seriously impressed with the energy that they have, because they're just right in there doing it.
Awesome. We know, and in the report, you talk about Maui's capacity. Your projected capacity is 10, basically 10 cases per day. You're kind of in the same boat as Kauai. We have very limited hospital capacity here. But, we've seen the incredible spike in numbers on Maui over the last couple of months, I guess. I've kind of lost track of time, but and the cluster reports comes out, and it talks about clusters in hospitality industry, or of course the Maui MCCC. As far as the numbers and the increase, the spikes, how much do you think, Dr. Pang or Dr. Ho, anyone, can be attributed to travel? That in fact we know the virus gets here from travel. Are you guys feeling like the more travelers that come to Maui, the higher the cases will go?
Well, at first, don't forget, travel is returning resident and then out-of-state visitor. So both. If a returning resident has been on the mainland like 3 weeks, the chance of coming in with COVID is just like anybody come from the mainland. So we just lump them as travelers. Now, initially, say before the numbers from Maui climbed, there were some pretty hot outbreaks, right? So one was Pacific Islanders repeatedly. And then we had the prison and the prison and then prison. We had Lanai. You remember Lanai, man, that really was a spike, Pacific Islanders. And then once you tap all that down, kind of talk to them repeatedly and control it, then we began to see probably travel-related things, the hotel front desk, once in a while a visitor, restaurants that travelers go to, bars, things like that. And then you really began to see the last maybe month, these little clusters coming out here and there. And even now we still have the prisoners, but I just exclude them. I say, hey, who's left? And it's all these little clusters spilling over from the travelers. Now, we don't see it in the travelers themselves. Once in a while, they get sick enough, go to hospital, and then they got to get tested. And it's reported as traveler, but it's there. And the thing that really reinforces it, because the variant, the travelers brought in the variant, the California variant, and we could see it rise in Maui over the last, say 10 weeks when it first came. And then maybe 5-6 weeks ago, it was 50%. And then it was 66%. And the last I looked, it was 75%. I mean, where do you think the California variant's coming from? Not just California, but I read today, it has spread all through the US, going eastward. So, where do you think it's coming from? You don't see it in the visitors because they don't want to be tested unless they're really sick. But it will be in the spillover. So, Dr. Char, she says, well, we had the right to chase with the vaccine wherever we see it. So, of course, we gave the third time now the prisoners, the third time now the Pacific Islanders. And this week we identified, and we started going on Friday, the hotels and their associated restaurants where we start to see the spillover to the clerks and their larger families, take it home to family. And I was always reluctant to go to the bars because I thought that's not essential. We can close a bar. But Dr. Char said, if you see it there, go. So we're going to target some freestanding bars, So we have to do this if you're going to keep the visitor industry open. Pretty sure now where it's coming from. Now, our variant is here, the California variant. So if we did another departure study, we would do it since we got COVID, since we got the variant, you would do it looking at other variants. Because if they're positive when they leave, well, how do you know where you got it? We got so much on Maui and so much variant on Maui. Trust me, you're looking at the other variants, the UK variant, the Brazilian variant. You read the reports from Brazil. these guys seem to get COVID twice, the normal COVID and then the Brazilian COVID, Brazilian variant, P1. I mean, somebody's got to watch this stuff come in. And when the really dangerous stuff comes in that can dodge a previous infection, or God help us if it dodges the vaccine, then you got some decisions to make to decide qualitatively, do you want to restrict the kind of visitor or just numbers? So somebody needs to monitor this on departure if you're not going to try to titrate what's coming in. Over.
I'm hoping that we can implement some kind of departure testing here on Kauai. I know Dr. Kapono was working on that, Dr. Kapono Chong Hansen, because I think it's important that once we open up the safe travels, Kauai is I mean, Maui's nice too, but Kauai and Maui are the two most sought after destinations in the state. And, you know, I'm very, very, very concerned. So Dr. Ho, the visitor comes in, spends the vacation, and like Dr. Pang said, if they don't get sick, they don't get tested. If they don't get really sick enough for them to go to the doctor, they don't get tested. And then they leave, there's no departure testing, and they leave behind what Dr. Pang just talked about at the front desk or at the restaurants or the bars. What percentage of cases you think on Maui is attributed to that type? Or is it truly, if you listen to the state, and I know you both work for the state, so I'm trying to be very gentle here. But if you listen to the media, they portray a picture that it's community spread, that it's not travel related. Kauai, I think we're the only county that actually breaks it down by travel related, and as far as resident or visitor, and whether it was inter-island or trans-Pacific travel. We get that report whenever we get a case. But how can we determine whether or not it's truly community spread or travel related?
So I think the tricky thing is that, like Dr. Pang said, a lot of these variants are from returning residents or travelers. And a lot of these travelers, they're spending a lot of time outside. They're going to restaurants. They're staying at hotels, but they're not necessarily really interacting so much with the community. And so it's really with the hospitality. And then what happens is that, you know, those kind of single cases then kind of spread. And then, you know, I think we've kind of come in waves in Maui in terms of kind of how enforced, I think, in some ways, a lot of the recommendations are. So I think at different periods, you know, everyone's wearing masks, everyone's really staying in groups 5 or less. And I think it was just hard because we had Thanksgiving, we had Christmas, we had New Year's, we had, you know, Valentine's Day, St. Patty's, you know, all these kind of different holidays. You know, we all feel so suffocated already in some ways, like with all the restrictions, that during these periods, I think people are probably gathering a bit more than we're hoping. So it's tricky because with the community spread, you know, a few single cases might happen, but then especially with these variants being more infectious, then it's oftentimes spreading within the community. And, you know, we're a very loving community, and every family's important, friends are important, and we're all trying to spend time outside and be safe, and especially keeping our elderly safe. But I think in general, like, especially, you know, I think sometimes it waxes and wanes in terms of how much everyone's following the recommendations of the mayor. I don't have any numbers to give you. I think Dr. Pang might have a better general sense. I know with the contact tracing, when we do find a case, we do, you know, really find out. And as he said, a lot of these clusters, it might be one person who has, you know, 20, 25 people in their family that might live in their house or right next door. And so all of them are getting infected. So it's a cluster, but then we try to find it and tell them all to quarantine and isolate. So the numbers have, you know, been in the double digits now for a little bit, but I think we are having a lot of these cases of these clusters of families. So I don't know, Dr. Pang, if you have a better sense of any numbers in terms of percentages.
Generally, I'll give you an example. I think this will drive it home. Back then, there was a teacher who was, no, there was a kid who was positive. And then where'd you get it from? Well, there was a soccer game. Okay, so then we found the kid who gave it to the kid. Well, who gave it to the kid? Well, with the mother. Oh, okay. Well, who is she? She's a teacher. Oh, okay. So they got it from the mother. Well, where did she get it from? Well, she's married to a hotel front desk worker. So if you're lucky, the contact tracers can take it back 2 or 3 generations. But beyond that, I mean, it could be anybody out there. And then we don't have time really to trace it back that far. And if somebody says, that's why we want contact tracing. Wait a minute, wait. If I can pick it off right now with a front desk, because that's who we're seeing now, and some other restaurant workers who serve visitors or returning residents sometimes, that's enough. I mean, if you want me to trace back everything to say I'm 99% instead of 93%, I think that's a little bit overkill. We are getting the idea. If it ain't the prisons, hey, wait a minute. What about the Pacific Islanders? Oh, sorry, but they work in groups, maintenance and people who clean. And these guys work at the hotels too. So, I think it's pretty obvious. And then you saw how quickly the variant spread. And it is true. Once the variant's here, it can go community. But maybe 3 generations if you trace it back far enough. So we kind of stand by that. And if you want us to prove what Amy says again, go ahead, pick off the next variant coming in, the UK variant. Watch how quickly that spreads, or the Brazilian variants. I mean, but you can use the variant as a marker for what's going on, but the variant itself is quite dangerous, right? More communicable, maybe more severe disease, the UK variant. And then go read about the Brazilian variant. Apparently, it seems to dodge the previous COVID infection. So people are claiming, and I believe them, my colleagues wrote to me today, they work in prominent institutions, that guy got a normal COVID, and a lot of them are getting the Brazilian COVID variant again and sick also. So this is more than just mapping and tracking. We are afraid of the variant. Over.
I'm smiling only because Charlie always talks about going out to the garden, watering the dirt, and all this COVID start popping up in Hawaii. It's he makes it a joke, but it's exactly what you're saying. I mean, we're not creating the virus here in Hawaii, and Charlie's analogy is just perfect. Those are everything.
Let me ask you something, Dr. Pang and Dr. Ho. Is it possible to have, say, an asymptomatic saturation, where it gets so saturated? Because what you're saying is, if this isn't going to surface, they got to be sick enough so you can test them to surface. If not, you're going to do a study like you've done. But other than that, the marketplace is saturated and everybody's asymptomatic. Is it possible where, the thing is not going to surface, but yet it may surface past an incubation period where people already leave, but leave it behind. So they keep on like going to a bank, right? Continue to deposit, but don't withdraw, continue to deposit. And the only ones withdrawing are the people that are getting sick. They don't want.
Oh, yeah. Well, wait. First of all, that surely is possible. There was an idea that the asymptomatics transmitting it more than the symptomatics. But take it one more step, right? Is it possible that somebody has so much infection, asymptomatic, right? I mean, really, there was a time that for every case we knew about, I think it was LA, they had like 40 cases picked off by antibody. So they said, wow, we really had it. Maybe we're immune. And you watch, there's 2 strange phenomena going on with the UK variant, which is very transmittable, right? The northern Michigan, Canada, really seem to be exploding with the UK variant. But look at the UK variant in Florida. It's dominating the COVID percent, but the cases aren't rising. Like, what is that? Good question. What is that? So maybe, the variants are blocked by having the other disease, symptomatic or not. And then like Brazil, maybe not. I mean, there's kind of a whole lot we don't know about COVID, let alone its variants, let alone the interaction of the variant. But if you want to just say, wow, we can do all the tourists. Kauai has a qualitatively different kind of tourists. or Big Island, just say Big Island, they know they're going to get a second test. So if you're sick, don't go. You'll be picked off by the second test. Or if you, after you get tested, don't have a big bon voyage party every night, because if you get sick and we pick you off at the airport, that changes your travel plans. So maybe Hawaii can go after these qualitatively well-behaved patients. Maybe not. Maui, we thought we could take that niche, the quality patient. But I got from the what is it, the wedding industry. No, they're all going to come here. They're all going to go. We depend on a lot of in and out people. So it's not the quality guy who's going to stay there 1 month, who's going to, get tested and, special quarantine till they get tested. We thought we didn't have that much of a niche market. Maybe you do. Over, Amy.
Well,
Think about the spring break parties in Florida right now, where the UK variant is going nuts. How many of those thousands of people in the streets partying and no masks had their 72-hour pre-tests because they're planning on coming to Hawaii? And they're going to come to Hawaii after 3 days, like you said, of partying, and there'll be no way to intercept them without that second test. Zero.
But Mel, there's going to be this strange argument, even though the UK variant is so dominant, high percentage of the Florida, their case numbers are low. Like, what does that mean? What does that mean? What? You bring the UK variant here and our case numbers stay low? No, because the northern countries, Michigan and Canada, when they get the UK variant, it spikes. So it's not real clear what's going on. And anyone's going to point to, the guys who want that, they're going to point to Florida. The other guys who don't want it, they're going to point to Canada. But I can tell you, read about Brazil. I mean, you don't want that. And then the South African strain is bad too. You open to tourism, you're just asking for whatever comes in, unless you can kind of control it a little, titrate it. I don't want to shut down tourism, but can we get a little better behaved tourists?
Well, let me kind of throw something in there, and I'll ask both of you, and as well as Dana. With your study that you've done, and it seems to match up to what the experts have seen, this is clear-cut evidence that it's there per thousand, because it was almost fascinating when we had the LG on with us, and it was like an argument, because he said that it's 1 per 1,000, and we said no, it got to be more, and he emphatically stated no, it's 1 per 1,000. Well, your evidence shows it's more than that. Because we know that now, why do you think the state holds on to the position? And I understand because of the economy, but why do you think they hold on to the position that we don't want to hear it? Because if we're talking about the safety of the people who reside here, right? It's almost like putting up a net out in the ocean, because we know that there's imminent shark attacks. So if people want to go swimming, we put up that net. What they're saying, if people want to come, you take the net down, and we who live here, you just take whatever the dice is rolled. I don't think that's fair enough. And I think that's what a lot of, I'm looking at the comments coming over the screen. That's what people are trying to understand. We have all this studies that's done, and it's proven that we definitely have a problem. But yet the problem, it almost seems like it's not being addressed in a proper way. And that is, if we need a second test, damn it, because look what happened when the mayor of Kauai wanted a second test, right? He was iced out by the governor. But yet the Big Island got their second test, right? And then there was no qualms about that. So why is there this great disparity between the two? So as long as we have it here, I'm just trying to voice what a lot of the viewers are asking. How do we stay safe? How do we get to that point? We understand, I mean, it's bad enough when you have a good majority of visitors coming that behave, but then you have that few, and like they say, we always did a study. We genome sequenced 75 tests, right? And we had 0. Okay, but what if the positive case was number 76? You missed it by 1. Who knows, right? So the thing is, it's like playing hide and seek, and what baffles me is if you come from the old school, you just set up the dragnet and you catch everything that comes through. That would be the safest way. But I guess two things would come into mind. They probably told you, Department of Health, we only have so much money, so we can't be doing all those testing. I think maybe that's one reason. Or if you do it long and hard enough, you're going to chase the tourists away. They used to tell us that. But Kauai, we still had tourists coming, even during when we were shut down. So that argument, I don't buy that because if you're looking for that qualitative, you're going to have the ones that will spend $2,000 to $3,000 a day, as opposed to those fly-by-night specials where pay $59 round trip and maybe spend $100 a day. And those are the haphazard ones. You'll get those. You'll get. So my question to both of you is, what can be done to make it more safe? I think you're onto something, but it's just like it's falling on deaf ears, especially from the top, because they don't want to inconvenience the traveler. Well, either you inconvenience or you roll the dice and you make it unsafe. I mean, it's one or the other, and I don't have the answer for it.
Before they answer, can I just add a comment, an observation, just from being so involved with Kauai discussion group and Kauai's experts and being a diehard fan of you guys, Mel and Charlie, and everyone on the thread. I mean, I feel like a lot of us are Ohana, just from viewing the show and seeing everybody's comments and seeing everyone's concerns about how they're they care, and it's not and I from Maui, I would be like, Kauai, just give us a little bit of your magic, share your secret with Maui, share with the rest of the islands, and you guys are so tight knit, and I feel like from the outside, it's you guys had the secret ingredient where you stayed safe and you kept your community spread really traceable and really low, and you knew what was coming in and out, and you were able to report the numbers. And I wanted to say that if you just compare the two islands, from October 15th when the travel opened, you can see the pattern of what has happened between our islands and what happened when Kauai opened up, and then when you decided to opt out, Mayor Kawakami did, and you can look at the schools and the metrics for schools as kind of a gauge, because schools on Maui were in purple, and purple is the worst case scenario where all students are supposed to distance learn from home, and we were stuck there for a good month and a half or so, I would say. And Kauai was in the green, simultaneously. I mean, that's kind of a picture that to me is worth 1,000 words, So I just wanted to make that observation.
Thank you, Dana. In the study, and I know because this is the fastest hour we've ever had, I will tell you. We've had very quick hours, but this one is rapid. In the study, you talk about additional mitigation layer for travelers is recommended. That is specific in your conclusion. And I'll definitely want to let you guys have an opportunity to share at the end, but if you could touch on what that means, and also how does that tie in with the plan to have a vaccine passport. It was real interesting when I saw the article that the lieutenant governor is pushing for the vaccine passport shortly, but mum's the word from the governor or the health director or anyone else at this point. So the question is, additional mitigation layer. To me, that sounds like a second test. And how does that, what is your position or what is your thoughts on allowing people to come in simply with proof of a second vaccination shot plus 14 days? What are your concerns, or if any, on that? And we can start with you, Dr. Pang.
You should start with Dr. Amy first.
Okay, Dr. Amy.
Okay. Yeah, I feel like we're in a really like critical influx point right now where, we're suspecting that we know that the California variant one of them has already come to the island and dominating really in terms of the percentage of types of COVID we're getting. And I feel like this is a really critical point where we can really reduce and make an impact on, limiting the amount that's coming in terms of the other strains. And so I think collectively we acknowledge that, and like I feel very strongly about the post-arrival test. And I can see the benefits of a rapid test because you can do it right in the airport and get a result and be effective immediately, or a PCR, which is more accurate. And but we can always confirm with that and even do some variant testing. So I think, as you mentioned, financially, we would, if we were to do that, we would make sure we'd have a plan to how we can provide all these tests and make it a mandatory for every single arrival, resident and non-residents. And then, so that would be a full plan that we would have to set up and put. There's also the question of whether you quarantine and then get tested later. I think logistically that might be a bit harder to do, but I really do feel strongly that this is a critical point. I think in general, yeah, I think the other thing, yeah, I think I'll just have Dr. Pang talk because he's more talking with the mayor, because I think I'm more on the medical side where I see the data, I see what we can do. I recognize we're an island, and I recognize the tension of the economy and the medical side, but like I'm feeling very strongly about additional mitigation layer. But I think just the practicality of setting that up and getting everybody on board, I think he's more kind of in that realm. So
Okay, so let me just jump right into the vaccine passport. Okay, initially they were talking about this, but there was a little bit hesitancy on the part of CDC spreading to the governor, who kind of listened, because I think they showed that at least in primates, yeah, in the monkeys, they gave them the full dose of 2 vaccines and they waited till the vaccine had its effect. And then they went and they had control monkeys who got placebo and then the vaccinated monkeys. And I think they kind of made them breathe COVID. And lo and behold, the vaccinated monkeys didn't get sick and they didn't get infected down in their lungs, but they ended up carrying COVID in their noses. And it wasn't, I mean, it was growing in their noses. So you had simply converted, you made carriers. And good, the monkey never got sick, the monkey never died and all. But they didn't quite finish up those studies, did they? They didn't test the carriage that the monkey had in the nose to see if it was infectious, either in cells or transmittable to other monkeys, okay? That should have been kind of standard. But when they saw that, they said, whoa, monkeys, the vaccine just made them carriers. And so we were wondering, well, what do we do with that? So I think they're repeating it in humans. I remember humans were volunteering after vaccine to say, well, I'll get blasted in the face and I won't get sick and die, but let's just see if I'm a carrier. And so I'm hoping we get that result soon, because if it's true that they are carrying it, but that stuff they carry is not infectious, trust me, it can be swamped by antibody in your nose, one antibody, IgA, I mean, stuff like that. Or it's just, I don't know, that would lend a lot of credence to the vaccine passport, but you better do it quickly, because right now, I think most of the variants are susceptible to the vaccines, but in a little while, as they evolve, we're already seeing strains, variants dodging previous infection, and your vaccines are mimicking previous infection, trying to, and so it's just a matter of time before your variants dodge the vaccine. So if you have a vaccine passport, it might only be good, hey, just like flu, man, every flu season you get another different flu shot. How'd you like to say, hey, I got this shot from last year's flu vaccine, so I'm good? Oh no, that was last year's or 2 years ago. So that idea is kind of generating and can pick up some steam, and soon we should get some idea, at least for this year's variants can be blocked by these vaccines, and hopefully it's not that infectious. Over.
When, if you know, I'm not sure if you know the answer to this, but when should we know, when will we know whether or not someone that has been vaccinated, I mean, you got 3 different vaccines now, and some do what others don't, and so forth. And with the variants, we still don't know. But how long before we do know whether or not vaccinated people can actually spread COVID or catch COVID? We've heard cases where vaccinated people have gotten COVID, but the question I have, and I think many people have, by allowing visitors or travelers, returning residents to come back to Hawaii, simply with the vaccine, are we in fact creating a bigger problem for our residents here?
Okay, first of all, vaccinated people have gotten COVID because the vaccine's only 95% protective. So that 5%, you might see them. Second of all, some guys vaccinated, they didn't get the full vaccine. You got to wait 15 or maybe throw in another week, 21 days after the second shot. Maybe they were already inoculated. So just remove those. So you take fully vaccinated people and they volunteer. You make them breathe COVID. They're not going to get sick. They're not going to die. I thought those studies should be out real soon, man, because everybody wants to know. And it's not hard. I mean, a lot of people volunteering, because they want to push that. And I think you'll find it in their nose, but hopefully it's not that infectious or it's in low numbers or something like that. They didn't quite complete the primate studies, So I think that should be out soon, but we all have to agree beforehand, without knowing the results. Let's pretend we got the results, Mel. Hey, Mel, if it's like this, we're going to do that, right? Not
Right.
like, oh, now what? Now we got to explain this away. Maybe you got the wrong monkey. Wait, those are humans. Oh, okay. So that's the other thing. You got to agree beforehand and not like ding around with the data, like afterwards. Like, I hate to say this, but you kind of got to agree beforehand. If you did a random representative sample, but so many guys self-selected out, you got to agree beforehand what you're going to do with the data, no matter what it shows. It can show high infection rate, only the sick got tested, or very low, nobody want tested. You got to agree beforehand. And that's why I taught for the World Health Organization, these study designs, before you actually see the results. 20 years I taught for them. Thank you.
It becomes very, very strange in a sense, what you're saying, and I agree wholeheartedly that now, if we're saying, and Mel and I talked about this when the vaccines first rolled out. You remember one show, Mel, we said, hey, but the vaccine is protecting me from the symptoms, from getting the symptoms really bad. But it's not telling me whether if I should come in contact with it, if I can stop it dead in its tracks. It's not telling me that. So now I said, so if that's the case, then once I get the vaccine, we all become asymptomatic because we'll be carrying that damn thing with us. And the problem is, and we've kind of argued this point, that is, if we start looking at those who just refuse to get vaccinated, right? Because they bring up the subject of herd immunity. Okay. Hawaii being a transit location, you need about 75 to 80% before you get herd immunity. But if you're constantly shifting the population, how can you maintain that 80%? That's the part that I could never understand. Then you take the numbers when you look at the efficacy, which is something totally different, and you say, well, you got 95 on one hand, but you got that 5%. Heaven forbid that 5% ends up in one street, one neighborhood, and it goes wild. It's not like it's spread out, diluted all over the place. If it should be there, then what happens? So, we got so many of these things coming up, and yet people have watched the shows, they have watched your show, they have watched many other shows, and they're getting pretty akamai because when it first came out, we never know what the heck. In fact, the very first show we had, I asked the question, I said, hey, why don't we release the location? You don't have to release the name of the person because If you want people to buy in to keep safe, we will want to know, because just like down at the Wailea or any place like that, you get on shock attack. Oh, you tell the whole world the person got beat down in Wailea. When it comes to COVID, you won't even tell them what even neighborhood the thing happened. Doesn't mean that we're talking about this house, but this is where it was found. So all of these kind of things, it kind of has this whipsawing effect that, you know, you're trying to accomplish something, but yet it's kind of defeating it. And the last thing is, when you get the CDC saying, okay, now if you got vaccinated, you don't have to wear masks. People tend to forget. They don't keep on reading beyond that, because they're saying that if you got vaccinated, but you come in contact with somebody that hasn't been vaccinated, you should keep on using your mask. But people like to hear, oh, they said we don't need to use masks, and they only stop at that point when they should be reading more into the paragraph what they really said. So when you get, and you know, and again, I don't want to ding the LG, but you know, when he's telling us that, hey, once you get vaccinated, you're total immune. You say stuff like that, okay, and you say it on your morning press conference, people get the wrong impression. That's where the complacency, because we're always asking, why the heck is everybody getting so complacent? Oh, the Lieutenant Governor said, once you get vaccinated, you 100% immune. I said, you know what? The jury is still out yet. Just everybody chill and let's see what happens. But nobody wants to wait. And that's why it's this never-ending battle we're fighting in trying to get, you know, people to understand. And you know, like we said before, if we did it right the first time, we wouldn't be here now kicking the can down the road. But that's what we're doing right now. We're just kicking the can down the road. We need to put an end to it. But people got to buy in. But because there's so much of these options that's given to them, and people just don't want to read beyond a certain level, that's when they just said, hey, I heard it. They said, I don't have to use a mask. Well, what did Fauci say to Rand Paul the other day in the congressional hearing? He says, masks are not theatrical. It's there for a reason. The vaccine will take care of the original virus. The mask is to take care of the new variants. That's why you got to use the mask. Okay. Yet Rand Paul says, no, it's all theatrical. If you hear somebody, if somebody only hears the part about not having to use the mask, that's all they're going to believe in. They're not going to listen to the rest of the story. And that's why I've always said from day one, and Mel is the same way. You know, it's all about the messaging. If we got the right message from day one, I think a lot of problems would have been eliminated. But there's so many scattered messages. It's been way off the charts. Way off the charts.
You know, Charlie, I didn't want to go politics local, but I was just about to say that Rand Paul arguing with Fauci. Fauci can't get an edge in, you know, Rand Paul's a doc, Fauci's a doc. But, you know, Rand Paul, when you're actually waiting for him to say something, he goes, you know, your idea of Fauci defies our knowledge of immunity. I'm sorry, he's wrong. I consult for the US Congress. He had no idea how intricate and complicated immunity is, okay? And if Rand Paul, you're listening, tell me about IgY. Go ahead, tell me, Rand Paul, about that. Tell me about IgA. We know just enough to be dangerous. And in general, Fauci, he doesn't know a whole lot, he admits, and so he's cautious, okay? So this kind of stuff, like I did immunology in medical school. I know enough to say vaccine makes you immune. Are you kidding me? You're kidding me, right? Sit in on the congressional hearings with me if you get invited and see how little we know, really.
And I think, Dr. Pang, that's what Charlie was alluding to earlier is if you hear our own Lieutenant Governor, so you hear the same thing, that you get complete immunity, which is still not, well, it's not true, and it won't be true. I'm not an immunologist, but I can read and I can pay attention to experts. We've had Dr. Jerome Kim on our show from the International Vaccine Institute, and from very early on, he kept us abreast on the development of the vaccine. He said very early on that one of the things that were not being tested in the trials was the whether or not you could catch or transmit this virus after you got vaccinated. That was never done. Those trials were never done. So there's, like you said, there's a lot of unknowns. I did want to, I know because we're past the 8 o'clock hour. I appreciate you guys and appreciate your time. And I did want to give you guys an opportunity to close out with whatever you want to talk about. I did want to There's a lot of questions, and I'm sorry I can't get to all of your questions. Questions about when will Maui get vaccinated. I mean, that's a whole nother hour show. I mean, I think we're all waiting for supply, and that's going to run its course. But as far as this study, because that was the focus, and what are your thoughts? And you can incorporate this in your closing comments, and we'll get you guys out of here as soon as we're done. As far as a second test for returning residents, or I'll just say travelers. Let's just call them travelers. You can incorporate that, and then once you guys are all done, we can Haley on. Whoever wants to go first.
Yeah, I think just like kind of some closing remarks. I think in general, I think it's a good way to view the COVID vaccine the way we view the flu vaccine. So with the flu, it really kills off like kids, pregnant, and elderly. And so we do the flu to protect ourselves and our community. So we get the flu, and some of us still get it, but we're trying to limit the transmission. We're trying to improve immunity in our community, and the deaths from flu have significantly dropped, but there's still several thousand per year. They're still dying from the flu. We just don't talk about it. And so I think when we think about the COVID vaccine, it's a similar idea where COVID seems to really have high mortality and morbidity, and especially in the elderly and those with more chronic disease. And so what we're trying to do with this vaccine is it's not going to be perfect. It's a mutating virus, the same as flu. But what we're trying to do is reduce serious death and hospitalization. And I think the data is slowly coming in because it's work in progress. I think Pfizer's a little bit ahead since they started their trials earlier, but they are showing percentages drop in hospitalizations and deaths. So I think it's good to view the vaccine as not that you're fully immune, but that it's reducing serious disease around the world, and then helping us improve our immunity. So it's not like the save all. And I think Dr. Fauci has also kind of moved towards also really putting some emphasis on treatment towards serious COVID. So I'm thankful that we're going at it from different prongs. We're doing the vaccination to kind of reduce serious manifestations. We're working more on treatments and antivirals that can slow down or actually treat. And then I think with the travel restrictions with CDC, I think it was January 20th, in January, they're requiring international travel coming back to the US. They're requiring the 72-hour COVID testing. So we're very happy about that. And part of why we thought this study was very timely was because now that every single airport is essentially, supposed to check that there's a negative result within 72 hours. I don't know how well it's being implemented, but it's supposed to be required from all the airports that this study, we did in 10 days. It could easily be done in other cities that are dealing with variants coming in and things like that. So that's another point, was just that this study is really relevant, especially now it's an international thing. And hopefully we will see the numbers and the things improve. And then lastly, just to answer your question, I feel strongly about a post-arrival test. I recognize, I think it will work better if it's required for everybody, because if we make it voluntary, a lot of people are not gonna opt in for it. But it's logistically, how do we make it mandatory? And then, those type of things. But I'm feeling that, especially before we're getting inundated from other strains, I think if we can put a second layer of mitigation, that would be, I think, effective. Thanks.
Thank you. Dana, I'm going to save Dr. Pang for last.
I didn't want to cut in, but I was thinking, save the best for last.
You still look angry, though. I don't know what's the matter. I think we got to get him some hot chocolate.
Maybe just focused. But I just was listening to, the discussion, and, one of the things you guys brought up was the messaging. And that is something that got me fully activated from the very beginning. A little over a year ago now, where I just felt instinctually that we needed the messaging to be there, and we needed the right kind of messaging and the unifying messaging that's gonna, you know, Hawaii of all places is, you know, we're known for aloha, and we're known for love and caring for each other. And, you know, in ways I've seen the most incredible aloha that can be expressed, you know, when people just simply use the precautions. You know, Dr. Pang used to say the 7 W's. I like increased those, or the 5 W's, and I think I gave like 2 extras, you know, and people were like, that's too many W's. But, you know, the one that I stuck on the very end was, we are in this together, you know, and it is a we effort. And I just want to say, as far as tackling this, it's not going to happen if we're not working together. And in that, I mean that we're all, it's not industry versus industry. It's not island versus island, you know, even though Maui kind of got the brunt of everything, I 100% support Kauai. I don't care if the travelers are putting us more at risk. I'm focused now on how do we protect Hawaii, because you have something that's sacred, that's really hard to get back once it's lost, you know. So, and I mean, I'm just speaking as an individual here, and these are my own personal thoughts as far as, you know, what I've observed. But it's, how can we protect each other? How can we work together? How can, you know, and part of the task force that I've been involved in, the efforts are, how do we, not just healthcare workers working with healthcare workers, you know, not just teachers working with teachers. How are we going to know what's going on in schools if teachers and healthcare workers aren't working together, you know? And same with the travel industry. So I feel if we're all, you know, pulling together, even if we're not, you know, and schools is another thing. It's like, I think everybody can agree, nobody would want unsafe schools. And to have safe schools, you have to have safe travel. So, you know, if I think that's kind of a unifying factor there. And I hope that Mel and Charlie, you'll have some of the task force on again to talk more about schools as they are open or opening, you know, right after spring break now. And so, you know, I feel like a lot of times travel gets the spotlight, and things like in the community, you know, they get a little pushed off to the side because everyone gets so busy. So I hope we can, you know, increase our conversations with teachers and find out what the needs and concerns are, and with other industries, open the doors to communication and thinking outside the box for solutions. And finally, to just, you know, a lot of us who have been going strong for the last year, we're burning out. So we need more hands, you know, in the efforts. And some of these efforts are really just being on a Zoom call and listening and sharing information. So, you know, we've got community education is a huge thing. And if we get the right messaging out as far as the variants and the things that were discussed tonight, I feel like we have a better hope. And we don't want to repeat this year or worse. So I think we can get that messaging out ourselves. You know, we do what you're doing on this show. We talk to the experts, we talk to each other, we get our information from reliable sources, and that's what we share. So thanks.
Thank you. Dr. Pang.
Yeah, it's kind of like what Amy said. Initially, we're trying to protect those most susceptible to dying or plugging up the hospital beds. So, okay, we could try to do that. We'll vaccinate those people first. If we vaccinate a lot of the Hawaii's population, then the incoming traveler, it's kind of like a moot point, whether they carry it or not. If they carry it, hey, I've been vaccinated, you've been vaccinated, no problem, right? Or we might be damn lucky or some people might be lucky and they don't vaccinate a whole lot for whatever reason, they don't have vaccination. But the traveler was vaccinated, and maybe we'll find out that although they carry it, it's not infectious. I mean, maybe not, but at least vaccinate ourselves, what you were trying to do. So if they do carry infectious stuff in their nose, having gotten a traveler vaccine, we don't get sick and die. So, okay, I get it. So maybe we should raise the vaccine to ourselves and the people most encountering the travelers. Okay, but then what? Well, I'm sorry, but you kind of have to think a little bit ahead because, like Amy said, it's kind of like the flu. Like I got my vaccine card for last year. You got your vaccine card. So even if I gave it to you, hey, you don't get sick for that year. You look at countries that are evolving where the variant is changing because they can't control their infectiousness. Every time the thing replicates, every year it replicates, you got new variants. And all of a sudden, a new variant comes and it doesn't care what the traveler got vaccinated to or us protecting ourselves from travel. It doesn't care. And you might say, we deserve this. We vaccinated. We made sure the vaccine passport. We deserve this. You don't deserve it. You don't. It has nothing to do with what you deserve. It has to do with what the germ chooses to do. And now what? You get the vaccine passport from Americans coming here. Yeah, we're both vaccinated, you and me. But what about them coming from Brazil? What about South African strain? You don't think African strain comes up? It comes up. Meningitis B coming up sub-Saharan Africa. We've been vaccinated against meningitis Y, WCA, but not B. And that thing came into Princeton University. And then with it, man, they shut that thing down. They were so afraid. It's all this travel. And it's coming from sources that you didn't vaccinate that are evolving. Something's got to change here. If not immediately, okay, Charles, we can try to shut down all this mainland stuff travel. But sooner or later, somebody's going to come in with something really hot. And then it's just like Amy said, treat this like another flu, not mild, but a variation that you couldn't catch in time. And that's the thing you're facing. All this travel is one big soup, and one guy varying here, it affects all of us quickly, just like this pandemic, okay? So you're kind of lucky you saw this pandemic rather than start off with pandemic with variant. Whoa. That would have been a wake-up call, okay? And that's what you're seeing now. So let's watch perspective. I think we can vaccinate quickly. Maybe we can do the vaccine passport. Maybe they're not infectious if they're carrying. I mean, I want to give some credit to the LG here. I mean, we're hoping, and some guys like Rand Paul said, come on, can we just hope that way? Some of us, well, maybe not, but the monkey studies were not conclusive, and we repeat it in humans. I'll leave it at that. Thank you.
Awesome. Charles.
Well, as always, I'd like to say to our viewers, thanking each of our esteemed guests tonight, Dr. Lorrin Pang, Dr. Amy Ho, and Dana Moore. Thank you for joining Mel and I. The only closing comment I have is Amy said something very, very important. That is trying to get something that's viable to test in order for us to get it done and whether it can be affordable or not. And to that, and that note, because we've seen it time and time again, they never wanted to inconvenience the traveler by exposing them to additional costs of testing. Okay, we know that for a fact. It was openly said. In order for this program to work, in order for any program to work, to get even a second test, number one, we have to leave the politics out. Okay, politicians should stay away from this and just leave the experts like the doctors and everybody who does this for a living, leave them at the helm and let them deal with this, okay? I think then we'll get a better chance. But when you start inserting politics, that's when the boogeyman comes out. And that is when sometimes people get scared to take a bold stand, is when the politics come into play. We were promised, or I shouldn't say promised, I retract that. We were told that in order for us to open up safely, during this time when everything was shut down, it gave us a time to turn back the clock and say, how do we handle tourism? coming into Hawaii. Okay. One of it that was told to us by leaders of, I forget which organ, whether it was HTA or HLTA, one of the two, mentioned that it would be very important to see how things are turned back and done correctly this time. We're given that second chance, that new lease on life. Well, we opened up, and lo and behold, the floodgates just opened. There was no turning back on it. And so that's why in one of my posts, I had made mention, the only place that saw a change to keep Kauai pristine, especially one of our beloved beaches on the north side, is what they did. And they put a control point and they put an access, and that only 100 people can visit a day. And you apply for a permit. And if you're not on a list, sorry. But what does it do? It saves out on the amount of people going on there and ruining the beaches, because that's the only thing we have to share. If you want to keep it around for many more years to come, you got to do something. If you want to keep Hawaii pristine as possible, whether it be Waikiki, downtown Honolulu, Kalihi Valley, wherever, Nanakuli, you got to be able to dial back and say, hey, we got to take it. It's almost like a cadence. We got to do it right. So I think, folks, what you heard tonight is, number one, the study was done. It kind of validates what some of the experts, but yet at that time, the experts didn't have numbers like what our two esteemed guests have tonight. So you can go and say, hey, they came on and they shared the information. Last but not least, we've always said the messaging, and that is, this virus is nothing to fool around with. You got to take as much safety precaution as much as you can. I say that wholeheartedly with a conviction that when I started this venture with Mel, my brother was one of the first 3,000 that died in New York City from COVID. He didn't have to die, but he did. And that's why I preach this over and over again. He was one of the first when we discovered why the blood started to thicken, why they couldn't be dialyzed properly. We found all this stuff out, but now there are newer treatments to be done, and it's saving a lot of people. So all I'm saying is, if you don't have to get sick, don't fool around with this virus. Just stay away from it, mask up. If you get vaccinated as fast as you can. That's it, Mel.
Thank you, Charlie. Real quick, thank you, all of you. And I'll just read the names. Amy Ho, Genevieve Pang, Kristen Mills, Krishna Bayudan, Dana Moore, Luz Medina, and Lorrin Pang. Thank you, folks. You know what is the common denominator between this study and the study that was done, or the report that was done by the Kauai discussion group? The common denominator is data, factual data. And that is why the results are identical, the 7 per 1,000. I think we got to remember that. The other thing to highlight, and I highlighted this part, it is important for Hawaii to acknowledge the estimated introduction of 7 COVID-19 cases per 1,000 incoming mainland travelers. Given the potential to spread to the local community and our limited hospital capacity, we recommend another layer of mitigation to the community and our limited hospital. We recommend another layer of mitigation to the Safe Travels program for incoming travelers, such as scientifically based post-arrival testing with a shortened quarantine. That, I think, is what, as we go down this road with variants and all these new discoveries, I think those are the kinds of suggestions that our decision makers got to start listening to. But aside from that, I just want to say thank you all. I know you all are very busy. Dana, thank you for making the connections with us. Dr. Pang, I know you guys and Dr. Amy going crazy all day, all night. I cannot tell you how much we appreciate, and our viewers appreciate your time and sharing with us and informing and educating. We look forward to maybe having another discussion soon. We definitely have an open invitation to you all. If you want to come on and share, just let us know. Wednesday night, people, we have Dr. Dworkin. He was part of that Kauai discussion group, and he's going to talk about all kinds of stuff as well. Wednesday night at 7 o'clock. All right. Thank you again. You guys all stay safe. God bless. We love you all. Take care.
Take
See you
care.
guys on
Thank you
Wednesday.
so much.
Aloha.
Aloha.